Good afternoon, and thank you so much for joining us today for week 74 of the Flint Community webinar on coronavirus. I'm your host today, Yvonne Lewis, and on behalf of the Healthy Flint Research Coordinating Center, the Flint Center for Health Equity Solutions, and the Michigan Prevention Research Center, we're excited to be able to have this conversation with you today. We hope that as you're listening this afternoon, you will just let others know that we are here live on the webinar, but also YouTube and Facebook. If you want to like or send shares to or encourage others to share and like us today and be a part of this webinar, we would certainly appreciate it. If you are joining us by Facebook or YouTube, feel free to go to our website at info@hfrcc.org and put in any questions you might have as we're going through the webinar today. You may also give us a call at 810-835-2130, and we will be happy to entertain your questions for today. If you're actually in the webinar, we'd like to remind you to put your questions in the Q&A as we're going forward so that our panelists, we have a great team of panelists who will be able to answer any questions for you today. So again, my name is Yvonne Lewis, and I'm excited to have this opportunity to be the moderator today. I want you to just take again another look at all the partners that join us every week and have joined us for most of the 74 weeks that we've been here, and representatives from these organizations are available to answer questions as panelists for you. So I do want to encourage you, whatever questions that you might have as it relates to some of the information that we will share today or some of the information that we've shared previously, please feel free to put those questions in our Q&A. Some people have asked us, so Yvonne, what is it you're going to talk about on the webinar? We do put out a flyer every week to try to give you a sense of what we're going to be talking about during each weekly webinar. Today, we're going to focus in on earned income tax credit and child tax credit. I've been asked the question, Yvonne, why would you all address this? Well, we know in the world of COVID that all of us have been affected in some way, and so incomes have gone up and incomes have gone away. And so this is an opportunity for us to learn more about a benefit that has become available as a result of the coronavirus and understanding COVID data. We're still trying to figure out how all this data makes sense. We have a great team, a PhD epidemiologist and an MD that'll talk to us a little bit about that today. We'll have an update from the city of Flint, and you don't want to miss this update. And of course, we weekly have updates from the Genesee County Health Department to better understand what's happening as it relates to our public health world. And so I'm excited today to ask our panel that will be a part of this roundtable to join me for this next level of conversation that we'll have today. Dr. Deborah Fur-Holden and Dr. Susan Wolford will join us. I just want you to know too that we have a dynamic duo that's coming up, so we don't want you to miss them today. You can see, I want to especially welcome one of our newer panelists, Aurora. She's been here with us before, but Aurora, good morning. Good afternoon. We're glad to have you. And the dynamic duo between she and After the Shavers, they've got some great news to share with you today. So Dr. Deborah Fur-Holden and Dr. Wolford, we talked about this before. Dr. Deborah Fur-Holden, you're the PhD epidemiologist, and you help us to understand the data. Dr. Wolford is the MD who helps us understand some of the medical terminology and the medical understanding of this coronavirus. So I want to start with you, Dr. Deborah. We talked about this data and these numbers, the testing, why it's important, and how do we make sense of the data or the numbers that we hear every week. So can you just give us some insights on, we talked a little bit about it last week, the numbers, they change every week, and help us understand what this data really means for us in our community. And you are brilliant, Dr. Deborah, but I can't hear you.
I always do my best work on mute. Okay, so epidemiologists. People always talk about this pandemic, right? So epidemiologists study epidemics, and epidemics are disease outbreaks, or when you get disease in excess of what you would normally expect in a population. The pandemic is because that outbreak happened at a global level, worldwide. So we are in a global epidemic or a pandemic. Data is a fundamental tool that people like me and others, because even Dr. Wolford, I think, has an MPH. We have a lot of physicians who also have some public health preparation and training, because we know what they see in the clinic is a function of what's happening out in the community. But people like me really dig down deep into the data to try to understand at a population level what's happening. And we've got some, gaps and cracks, if you will, as it relates to COVID data. And I want to be clear, this is nothing unique to Flint or Genesee County. This is a global phenomenon that I'm talking about. So, first, let's visit this. COVID cases are solely a function of COVID tests. So let's say you are in a household and you got COVID and you got tested, and there's a partner and two children in your house, and they all develop symptoms. They got fevers, they lose taste and smell, and you're all pretty sure you've got COVID. But those other three people don't get tested. They don't actually show up in the case counts anywhere. We only can count cases as a function of people getting tested, right? So we do know that globally, the cases that we're reporting are underestimates because there are a lot of people who have COVID, don't know it, or who have COVID, know it, and didn't go get tested, just sheltered in place or, went into isolation and took care of themselves and recovered. Okay. The other caveat I want to give is that you are counted as a case when you took your test. And you remember earlier in the pandemic, for some people, it was taking 2 and 3 weeks for their test results to come back. So when we tell you about case counts for the week, we're telling you what we know at that moment. So we report in our health equity brief, which we'll talk about, a little bit later in the webinar. We talk about last week. We give you the snapshot on what we learned from the prior week. What happens is, let's say, like last week, if you looked at the brief from last week, we said that there were 81 cases, known COVID cases in Genesee County, and 17 in Flint. Between the end of that week and this current week, more cases have been added. In fact, there weren't 81 cases, there were actually 131 cases. 50 additional cases were added because when they got tested was that week. And you get counted when you are actually identified as a case. Also in Flint, we said we had 17 cases, but in fact, now those numbers have been updated. There are 29 cases, right? So the reason that I mention that to people is because we know we've got some undercounting issues. We've got undercounting because not everybody that is COVID positive is getting a COVID test and is showing up and being counted somewhere. And two, there's a lag in when people take a test and when that test result shows up in a database, so we can do the kind of community surveillance and reporting that we do on the webinar and that the health department does and things like that. So I always ask people to just remember the trends are important. As we start to see things increasing, that's the signal that whatever we're doing is having us move in the wrong direction. And what we've got is over the last 6 weeks in Genesee County and over the last 4 weeks in Flint, the cases have been continuing to increase. So what that's telling us is all of those great things that we did to flatten the curve, i.e. to bring that rate down, if something is increasing, the curve looks like this. It started here and then it goes up and it goes up and it goes up. So the curve looks like this. When we talk about flatten the curve, we're talking about bringing the number of cases down each week so that the numbers, instead of going up, start to go down and flatten out. The goal is to get the numbers down and keep them down and low and flat. So the caveat for people is don't get overly attached to a specific number. Know that this is a global problem that we face, but it's manageable. And the data still do tell us something. And what the data are telling us right now is cases are on the rise. It underscores the importance of masking, of practicing good distancing, good hand hygiene, and getting vaccinated. So
Dr. Deborah, I think we got a little bit comfortable because it looked like things were just so well, and we just wanted to go out and live and just have a good time and be around our family and friends. But what you're telling us is that we still need to exercise this level of caution, even as we're going out and being out and about with friends, because we can't always just say that number is totally it and we're just ready to go.
Yeah, and I just want to say I have a tremendous amount of just empathy for all of my, fellow global citizens. There are parts of the world where people have literally been on shutdown, where the government control is much stricter, and it's at a, national level. We have a lot of flexibility here. You've got governors with a lot of control over states, and then within states, county executives and things like that. There are other parts of the world where people were literally not allowed to leave their house for 4, 5, 6 months. So I do realize that most of us are truly sick and tired of COVID and over it. But that doesn't change the reality of where we are. And we are going to have to figure out how to live with COVID, because COVID is now endemic. This is something that we're no longer really, the goal is not to eradicate it. The goal is to try and mitigate its impact and bring it under control. We do have the tools to do that, but they're not the things that people want to do. It's summertime. Everybody wants to be at a barbecue and hugging and kissing and dancing and yelling at the game and all of that. But it just has to be done with public health precautions in mind, and with the full understanding that things are moving in the wrong direction. And as Dr. Wolford can tell us about, with these new variant strains that tend to spread more easily, it looks like they hang out in your nose and your throat longer, so you're more likely to be breathing them in and out. They have more opportunity to grow inside of you. It's just like, I understand we're all worn thin, but if we're really letting the data and public health be our guide, now is the time for us to really stay the course and not throw our hands in the air, because the reality of it is COVID is taking people's lives and it's taking people's vitality. People keep talking about the death toll, but they're not really talking about the fact that there are people who contracted COVID and they are not the same as before they got it. They're dealing with issues with their heart, with their breathing. I know several people who were runners. They say they can run, but they don't have the same wind anymore. We won't really understand the long-term effect of COVID for many years to come. So I tell people, this is an unnecessary gamble. This is not the time to gamble, because you're gambling and you don't even know what the stakes are. You think the stakes are having to be in isolation for 2 weeks, but what if the stakes are you're trading off your cardiovascular fitness for the next 20 years?
Yeah. Now, Dr. Deborah, we do this webinar because we want to make sure we're trying to provide some real information. And you threw in another word, so and you kind of explained it, but we've got now epidemic, we started, pandemic, and now you're saying endemic.
Yeah.
And all of the folks on our call, we're out here trying to help other people understand all of this. So I just want you to give us a little bit more clarity on this endemic. So you're saying what?
Great. This is perfect. So let me build it up. Endemic, in disease in community. How much, there's a certain amount of disease that we would expect, right? You hear standard rates, right? Like, 5%, of people will get, chicken pox this year, although not really, because now we have a chicken pox vaccine, which has really changed the landscape for chicken pox, right? I mean, it's, most of the things that we have battled with, right? When we were kids, we all just got chicken pox.
Just got it.
You just got it. You were home from school and you were covered in sores and you were itchy, and your mama gave you a chamomile oatmeal bath and rub you down with the calamine lotion, and we just had to get through it. Now they have chickenpox vaccines, so that's not even a good example, but there's just a certain amount of disease that we would expect in community, okay? That's what's known as endemic, like sort of what's just expected and already there. An epidemic is when that goes out of control. So like in Baltimore, where I came from, we had a lot of problems with injection drug use. And injection drug use and some of the things associated with it, we would have these outbreaks of syphilis and other diseases that people were spreading mostly as a function of their substance use. It would always happen in the summer too. We'd get these spikes because drug use would go up, people moving around, people interacting and things like that. So epidemic is when you get disease far in excess of what you would expect. So there's what we would normally expect, which is endemic. There's the excess, right? When it spirals out of control, and that's epidemic. And when you have disease that's epidemic in multiple places across the globe, we call that a pandemic, a global epidemic.
Thank you, Dr. Wolford. I mean, Dr. Deborah, thank you for that. I was thinking because that segues into what I want to talk to Dr. Wolford about. And as a medical doctor, we know you focus mostly on pediatrician. As a pediatrician, you focus mostly on children. But here now we're talking about this added level of disease, and we're seeing it more now in young people and children. And so, what are you recommending for us to think about as parents and adults, even in talking to the children about what's going on with this new variant, particularly?
So thank you so much, Yvonne. Yes, particularly in light of this new variant, I think what this has done for us is to emphasize what many epidemiologists and medical professionals knew sort of going into the pandemic, that pandemics wax and wane, that variants will occur, and that the virus, its goal is to try to survive. And the way it can do that is by getting into us, working out ways to get around our defenses, and then spreading that new and improved kind of virus. And because it does that, it's going to have these periods of waxing and waning. And so while last March, we all sort of thought, because this was the first time we were living through it, we sort of thought, okay, if we can just lock down, we can get through this and we can get right back to normal. There were those who had studied these things in the past that knew that wasn't going to be the case. And so we have to learn, as Dr. Deborah just mentioned, how to live with this thing that is now endemic. And people with children have to learn how to live with this while those children can't yet get vaccinated, right? Mm-hmm. The rest of us have a way to be fairly sure that we won't die from it or get severely ill from it, while we may actually still get it, but we can protect ourselves to a great extent by having the vaccine. If you have children under 12, that is not an option for them at the moment. So how do we learn to live with this? It's interesting that you should ask, because I was discussing, my husband was sharing with me, he doesn't often do this, but he was sharing with me what he plans to preach about in his message tomorrow. And he was talking about how to shelter from the storm and how to find protection and peace in a life that's full of pain, problems, and perplexities. And I thought, this is so much like the pandemic. Where do we find that shelter? How do we deal with this when it's waxing and waning and it's not going away? There are all of these problems. And I thought, in both circumstances, you have to find a trusted source of information. Is it your primary care physician? Is it this webinar? Is it, the CDC? You find a trusted source of information and you check it regularly, and then you plan based on that. As we've said before, it's much like the weather. You check the weather, you tell, oh, there's a huge storm coming. I might lose electricity. I've been told by Dr. Deb, it's not power that we lose, it's electricity that we lose, right? So we have our power. And what we know is that we might lose electricity. So as my mom says, go out and buy a torch, a flashlight. Don't buy one, buy 2 or 3. Have them in places where you know you might need them, where you can get to them quickly. Plan accordingly. So you know now, you've heard from all the trusted sources of information, the Delta variant is increasing. So now you wear a mask even outside. You definitely wear it inside. It doesn't matter what people who are maybe have less information may or may not say. You go to your trusted source of information and then plan according to that.
So Dr. Wolford, you're helping us understand, even with what you said, Dr. Deborah, there are going to be these outbreaks and then it'll kind of slow down. But if we're not careful, it breaks out again. And so we have to follow the necessary protocols. And there's a reporting process. How is it that the information gets from, like, me as an individual to the health department, to the state? What's the reporting process and what's the key in getting these cases reported?
Well, there is no direct way for you, Yvonne. Like I said, use that example earlier. If you are in a household with cases, a known case of COVID, and you've got all the symptoms, there's no number you can call and say, hey, I'm Yvonne Lewis. my daughter has COVID, I have all the symptoms, I have COVID, and then somebody put a hatch mark in a column somewhere. It doesn't work that way. Like I said, the cases are counted as a function of the tests, right? And
So-
we've all seen this. A lot of people have thought they had COVID and did not actually have COVID. I think more than not, where it's gone the other way. People know they have COVID, and our wonderful college babies did this. A lot of the college kids got COVID and purposely did not go get tested. They sweated it out in their dorm room because they didn't want to get in trouble and they didn't want to be forced to stay in isolation once their symptoms had subsided, or they knew they were or thought they were past that period of being able to infect others. So we just know that those cases are an undercount. So you take a test, that testing provider then enters that test result into a standardized database. And we have a standardized database in Michigan. That data is shared back to the local municipality. It's the local municipality where the person comes from. It's also shared with the state. So there is a system in the background again. And what happens is when the system gets overburdened, you remember, we had a lot of people getting tested because we had a lot of cases. It was taking longer to get those results back because the labs could process and do those tests as quickly as they could, right? And so the sort of gap that we have now is we're really trying to understand this new sort of, uptick that we're seeing. Is it related to the Delta variant? The CDC has said that more than 50% of the cases, this was a few weeks ago, in the US are the Delta variant. And I think the number has gone up to like over 70-75%. I know I just heard an updated number and I said, this is big. We were saying a few weeks ago that there were no Delta cases in Flint and Genesee County. And I said to everybody, whoa, we can't say that. What we can say is we have not yet detected one of those cases. So I want to make it clear for people, the way that this works is we send 10% of our samples to the state, of our COVID test samples. The state then will randomly pick 10% of those samples and they will do genomic sequencing of those. So they will test that particular sample to find out what strain of COVID it is. Now, do the math. What's 10% of 10%? That's 1%.
Yeah.
I got $10, right? And I say, I'm gonna give you 10% of my $10, I'm giving you $1. And then if you say, I'm gonna give Susan Wolford 10% of that, she's getting a dime. So they're testing 10% of 10%, because you got to get, the state is doing that for all 83, jurisdictions in Michigan. So just statistically speaking, if we only had that week, 40 samples that came out of Flint, 4 got sent to the state, and then they randomly sampled 10% of that, that would technically be 0.4 of a test. So they'll do 1.
Right.
So out of those 40 cases that we had, only 1 got tested.
And so it's really important that even though we don't know for sure if it's Delta or not, we need everybody. If you're out and about in community, please go get tested. We have testing sites at no cost for the members of our community. And now most of them have the rapid test. You can get your results back in 4 hours. And if not, you can definitely get them back within 24 hours at some of the sites. So we want to encourage you to please get tested so you can know your status, and then you can help your family. There's one more quick thing. We've got school coming up, and our health department is going to be coming up next to talk to us. But we know that our health officer did put out an order. And I see Kaylee. Kaylee, if you could just give us quickly an update on the mask order that the health officer has provided for our community. There you go.
Absolutely. Hi, Yvonne. Thank you so much for letting us come on this call. And thank you, Dr. Wolford and Dr. Verholden, for all of the information you provide. I was riveted listening to you. So I'm sure the community appreciates everything that you guys have to say. You guys are wonderful. So thank you. Yesterday, Dr. Hackert, who is our medical health officer, did announce that she is putting in an order requiring all students, staff, anyone that is in a K-6 setting to wear face masks while they are participating in educational activities. The order really includes a lot of information about the background of why that decision was made. We as the health department feel that anytime that we're putting out any type of order, the justification for that needs to be included with that order in order to promote transparency. We want people to know why the order is what the order is. We also in that order list some very specific, essentially, when does this order not apply? Obviously, one of those is when you're eating or drinking. You can't wear a mask when you're eating or drinking. Anything outside, as long as you're not wrestling outside at recess, a mask does not need to be worn. We are encouraging masking for individuals under 5, but we are not ordering it. One of the issues that we already put in there as well is, we've heard from a lot of different parents in schools. We are encouraging neurodivergent students to wear masks if they are able. But if they are not able, or if they're a student that really needs to use facial cues for their teachers to understand them, that's a situation in which they would be exempt from that. In that same vein, teachers who are working with children who are either hard of hearing or neurodivergent, again, those students that really rely on those facial cues or movement of the mouth to be able to communicate with their teachers. If the teacher is vaccinated, then obviously they're exempt from the mask, since that's a huge part of them being able to work with their students. But if they are unvaccinated, then they still do have to comply with that masking requirement. Our final exception to that is if you have a current medical reason that is confirmed by either a medical doctor or a doctor of osteopathic medicine, that's currently licensed to practice in the state of Michigan, you could also be exempted from this order. Really, right now, the long and short of the logic behind this is that, we want our whole community to be protected, but we really want to make sure that we're protecting those members of the community that does not have a safe, effective vaccine available to them yet. This order will end, it says 2 months, so essentially 8 weeks after the vaccine is available to children age 5 and up. The logic behind the 8 weeks is, as much as vaccination is incredibly important to people, we know that parents and students have rigorous schedules. So there's a little bit of time in there for parents to be able to get their children appointments to get vaccinated. And then since the Pfizer vaccine, it's 5 weeks from receipt of your first dose to when you're considered fully vaccinated. That is the allowance for that time, so that the mask order will be repealed once students whose parents wish to get them vaccinated have some time to get them vaccinated, and those vaccines are able to give the full immune potential that they can give to the people who have received them. So that's the logic behind that 8-week mark. I think that's important to explain so that people don't think that 8 weeks was just something we picked out of a hat.
Yeah.
So
thank you so much, Kaylee. We appreciate that. And so I was told that people can go on GC4Me, the health department's website, and get more details on that. And I'm sure there'll be more conversation as we move along about the order. So thank you, Kaylee, and thank you, Dr. Deborah, and thank you, Dr. Wolford. We'll be hearing more from you in just a few moments. I want to go quickly now to Sherelle. Sherelle's going to give us the added update from the health department. Good afternoon, Sherelle.
Good afternoon, everyone. And I wanted to thank both of you doctors as well, and Kaylee. I was going to open up with that new mask directive for the children. I do want to say that it is not a punishment to our children or the community to put that order in place. We want to protect our children and we want to protect our community. And as Kaylee said, there are those children who are out there who are unable to get the vaccine at this time because it is not authorized for them. So please do take precaution and keep your kids masked up. And in the meantime, those who are eligible, we encourage you to come out and get your vaccination. In Genesee County, we've administered over 330,000 vaccines over the county, and 44.8% of our residents are fully vaccinated, but we want to see more than that. We've seen 53.9% of 16 and older residents to get their first vaccine, and we want you guys to come back and complete your series and get your second vaccine. And anyone who has not been vaccinated, come get your vaccine. Come get it. We are hosting clinics throughout the week. Next slide, please. And those locations will be up shortly. I wanted to let you all know that, as mentioned before in this webinar, we are seeing a continued increase in cases within Genesee County. There's been a 32% increase in cases in the last 7 days. So Genesee County Health Department has confirmed 173 cases referred to us between July 30th and August 5th. It has climbed to 229 confirmed cases between August 6th and August 12th. Our 7-day positivity rate has increased. So that means that out of those tested, we're seeing more people come back with a positive test result. We're now at 8%. So there's been almost a 2% increase in our positivity rate, and the COVID-19 inpatient numbers in our hospital continue to increase as well. That Delta variant is spreading. So it's important that our children stay masked up, and everyone else in the community. And like I said before, if you haven't got your vaccine, please get it. You can come to any of these sites on this next slide. The ones that are indicated with a red asterisk, those are our standing clinics. So every week on Tuesday, Wednesday, and Thursday, you can catch us at Our Lady of Guadalupe, Central Church of the Nazarene, and then Shiloh Missionary Baptist Church. Those times will not change, nor the vaccine that is being offered. And you can see on the screen that this Sunday, if you're in the Brownell area, we have a pop-up clinic from 3 to 6 at 1807 Russet Place, where you can get your Pfizer vaccine as well as Johnson & Johnson. And then next Saturday, Agape Church will have a fun day, and we'll be out there at that event from 11 to 1 p.m. providing Pfizer and Johnson & Johnson, as well as at Salem Lutheran Church from 10 a.m. to 12 p.m. with the same vaccine. So we encourage you to pop up at any one of those clinics and get your vaccine. Bring your children who are eligible. We want to see an increase in our vaccination rates here in Genesee County. Next slide. And if you need somewhere to go get tested, I've received calls this week. People want to know where to go. You can visit Word of Life Church, Bethel United Methodist Church, and Macedonia Baptist Church. Those 3 churches will also be offering vaccinations soon as well. So you can get tested and you can get your vaccine. And if you can't make it to any of those churches, your local Walgreens or Rite Aid has testing, as well as Hamilton Community Health Network and Genesee Community Health Center. So you have a multitude of places to visit to get your testing and your vaccine. And if you are homebound, you can give us a call at 810-344-4800 for assistance to get your vaccination at home. We do have nurse who will come visit the home and administer vaccine. So you can give us a call again, 810-344-4800, or visit our website at gchd.us and complete the survey, and we'll get you hooked up with a vaccine.
Thank you so much, Sherelle. There are opportunities for our community, and we just will keep you updated every week because there'll be some new opportunities. So please continue to join our webinar. We're going to go back to Dr. Deborah. We've got a little bit more epi we need to do. Tell us a little bit about the specifics of Genesee County and the cases.
Yeah, I'm going to just breeze right through this because I think Sherelle did an excellent job. And I just want to acknowledge our wonderful partners at the health department, Sherelle and Brown and Kaylee and, Dr. Hackard, and just that amazing group of people in the partnership. It is the partnership that we have with the Genesee County Health Department that we're able to, work collaboratively and put these numbers out each week. So she already gave us the bottom line. The cases are on the rise in Genesee County and Flint, and so are hospitalizations. The case rate is going up. It's at somewhere between a 2- and 3-fold increase from last week. So, not to alarm people, but to just give them the facts. Things are going in the wrong direction. We talked about this, things will be going up and down. Well, things are going up right now. What that means is tighten up the prevention. Get vaccinated and practice those good personal prevention strategies, distancing, masking, and hand washing. If you look at what the cases look like by race, we're still keeping an eye toward the disparities, because what we know is unintervened, we saw early in the pandemic that we had, disproportionate impact in Black and brown communities all across the state of Michigan, in Hispanic populations, African American, and in Native American. So we're watching that. Again, one of the issues that we have with data is you can't report on data that people don't collect. So we're still pushing and advocating for all COVID testing providers to collect the minimum demographic variables so that we can ensure we don't have disproportionality by gender or by race or by where people live, or things like that. The number of unknown race cases, the health department does do a pretty good job of going back in and backfilling that. But as best we can tell, we've kept that racial disparities gap in COVID closed. So since Dr. Reynolds isn't here, last thing I'm gonna say is he calls it cadence testing. And cadence is like the beat, the rhythm of a song. And so your testing should follow the beat and the rhythm of your engagement in the world. If you're back at work and you're going to work every day, you should probably get tested every 2 weeks, even if you don't have symptoms. If you're back to work and you're going to work Monday through Friday, you should be getting tested every 2 weeks. And the cool thing is, even in the face of, a lot of strain on resources, Flint has done a very good job at keeping those testing resources in place. And all the barriers that you used to have, you had to make an appointment, you had to have insurance, you had to have none of that exists. You can go when it works for you. You can, get testing on demand. You can get vaccination on demand. So numbers increasing, disparities seem to be holding stable for now, but we need to elevate our efforts. Be that credible messenger for people in your family and in your workplace to get vaccinated, and just continue to practice prevention.
Thank you, Dr. Deborah. And I think you're going to hand off to your wonderful colleague, Mary Catherine.
Yes.
Okay, great. So thank you so much. And I just kind of want to reiterate the thank you to all of our amazing colleagues at the health department. We definitely rely on you guys a lot. So thank you so much for everything you do. So if you have any questions about the data or the brief, please shoot me an email at crawf457@msu.edu. If you have any more specific details about the data that is being presented, please shoot my colleague an email, Rick Sadler at sadlerr@msu.edu. So last week we introduced the idea of how other entities can almost be the policymakers, and I want to expand on that this week by talking about how insurance companies are going to have an opportunity to do that and increase our vaccine rates, and by encouraging people to not ignore the price tag of being unvaccinated and winding up in the hospital. It's actually been shown that higher health insurance costs can be a powerful motivator for eligible individuals holding out on getting any kind of vaccines, but in this terms, we're talking about COVID, of course, right? And that's because COVID hospitalizations are very expensive. And it's not just the cost for the individual who gets sick, but it has a societal impact for taxpayers and employers. In addition to, unpaid costs for hospitals as well. So as across the country, well, 97% of hospitalized patients with COVID in the last month were unvaccinated. And so we're really hoping this draws attention to the price that people will pay for healthcare if they get sick with COVID. And it actually might encourage them to get the vaccine, a safer and of course cheaper alternative to the illness and hospital bills that we see with COVID infections. The next thing I want to talk about, and I'm not going to go into too much detail because we have Afton here to really get in depth about it. But in the past, we've mentioned the earned income and the child tax credits that were introduced with the American Rescue Plan Act of 2021. And so what we would like to see happen is, and current congressional legislation is actually seeking to do this, is cement these expansions to these tax credits, which are so important for equity because they are going to lift so many children out of poverty. And I want to point out that in 2018, these combined credits alone lifted more than 5 million children out above the poverty line. And that was actually single-handedly surpassed the gains of any other program in existence. So, and the impacts are far more than just poverty. They reduce the number of low birth weights, premature babies, and adverse childhood health experiences and outcomes. So those are the two things today. You can get lots of great information and more resources and reading materials in the brief. So make sure you're signed up for that if you haven't already.
Thank you so much, Mary Catherine, and a great segue to the dynamic duo that's going to talk to us today. Afton Shavers, who's a program manager at the Greater Flint Health Coalition, and Aurora Sacetta, who is with Michigan United. So ladies, about this earned income tax credit and the child tax credit, people say, what does this have to do with COVID? Well, it is a result of some of the COVID issues that has raised this to the top of the table. So Afton, please help us talk about cases.
Absolutely. So not to be confused with COVID cases, we had an opportunity here at the Greater Flint Health Coalition to write a grant that is fostered through the Office of Minority Health to do a project that's called Community-Based Approaches to Strengthening Economic Supports for Working Families. And that's why we call it cases, because it's a long title. But basically, this project is a really innovative one, and it really was drawn together based on what Mary Catherine just sort of shared with you, that over time, the CDC and other health departments have really looked at how use of the earned income tax credit, and use meaning understanding it and claiming it on your tax return, can actually lift families above the poverty line. So in our community, we're really concerned about the poverty line because we know that poverty can be an indicator for some adverse or negative childhood experiences. And so we sort of combed through a whole bunch of research. We met with the wonderful folks over at the Office of Minority Health, and we got an opportunity to apply for a grant to fund this work. And so we're super excited about this project, and we've been working on it in tandem with a couple of our community partners in Genesee Health Plan, and then also with the United Way, with Michigan United, so that we can get word out to families in neighborhoods. We've also worked with our partners over at MSU. So Mary Catherine has really helped us delve into some data and give us a little bit of more research, because that is not my ministry. So we need to make sure we bring people along to the table that can sort of help us work through these things. So I always tell folks, leadership is absolutely not being the smartest person in the room. It's being smart enough to get people in the room that are smarter than you. So I say that to say Aurora is with us today. Aurora has been doing taxes in community for over 16 years, amongst all the other millions of things that Aurora does for our community. But she's going to kind of give a little bit better detail about the actual earned income tax credit, and then sort of what the new child tax credit is bringing to our local families here in Flint.
Thank you very much, Afton. And I am really thankful to be part of this effort, because as she said, I've been doing taxes for quite a few years. And so it's I'm pretty committed to it and passionate about our families getting more money in their pockets to be able to spend. So I'm gonna go ahead and start this. It's just a really short slide presentation, but it gives you the meat of the whole topic. And it's a quick crash course on tax credits. So today we're going to talk about the earned income tax credit and the child tax credit. And this credit is for low to moderate income workers with qualifying children. It's also very important to note that you may qualify for this credit even if you can't claim children on your tax return. So that's really important to know. A lot of individuals go right past that and don't even ask about it. So first of all, I'm going to talk about the earned income tax credit relief that was available this past tax season. It's if your earned income was higher in 2019 than in 2020, well, then you could use the 2019 amount to figure your earned income tax credit for 2020. So kind of it's a little circular there, but this is just a temporary relief that was provided through the Taxpayer Certainty and Disaster Tax Relief Act of 2020. So at this point, we're really not sure that is going to be available for this next year, but it did help a lot of families out because, as you know, because of COVID, our incomes fluctuated and some were higher, some were lower. So those that had a higher income in 2019, it benefited them to get a bigger tax credit. Of course, we use that income. Next slide. Okay, so to qualify for the earned income tax credit, you must show proof of earned income. You have investment income below the 3,650 in the tax year that you claim the credit. Because some things that a lot of taxpayers don't realize is that they think that because they only had a small amount of income this year that they could bunch it up and claim it the next year, which we always have to explain, no, you can only claim what you earned in the year that you're filing. So you must have a valid Social Security number and you must claim a certain filing status. And I'll explain the filing status in a minute here. And also important to know that you must be a US citizen or a resident alien all year. And that's really important to know. Earned income includes all taxable income and wages that you get from working for someone else, yourself, or from a business. So these are the filing statuses. To qualify for the earned income tax credit, you must file only one of these. Of course, it won't let you claim any other status anyway, but you must file as either married filing jointly or head of household, which means you are claiming dependents, or qualifying widow or widower, and or a single person. You cannot, this is really very important to know, that you cannot claim this credit if your filing status is married filing separately, because many times our couples think, well, my husband made too much money, so I'm going to file separately. Well, what they need to know is that they're not going to qualify for any of those credits. And so I usually try to discourage them from filing separately unless they don't qualify for the credits anyway. Okay, so this is a table that tells us just the limits of what people can earn to be able to file for these for the earned income tax credit. So as you can see in the table here, that if you do not file or if you don't claim any children or relatives, your maximum earned income as a single head of household or widow is $15,820. So what that means is that if you made more than $15,820, and this is a 2020 table, you will not get a credit. You won't qualify for credit. But if you're a married couple filing joint, you can make up to $21,710 and get a small earned income. Of course, if your income is a little bit less than that, your income or your tax credit would be a little bit higher. And then it goes on down the line with one child or relative, 2 children or relative, and 3 children or relative. So this is really good information to have, because a lot of times individuals don't know if they qualify for it. and they don't ask, and if the tax preparer doesn't tell them, they lose out on this money. Next slide. Okay, so if you qualify for the earned income tax credit, it's also very important to know that you may also qualify for other tax credits. There's the child tax credit and the credit for other dependents. And so you might ask, well, what's the difference between other dependents and the child tax credit? Well, if you claim other dependents, those could be your children over 17 years old, your adult children that are still living with you. That happens often, especially now when young people can't afford to move out on their own. You can still claim them as other dependent. It's just a smaller credit. And then there's the child and dependent care credit, and that credit is for any type of care that comes out of your pocket, and you can claim that at the end of the year, of course, with certain limits. And then finally, there's the education credits, and that's the American Opportunity Credit and the Lifetime Learning Credit. So here you have all these credits that are available to our community, and it's so very important for us to share that with our neighbors, our friends, our family that may not know this information. So I want to thank Afton, first of all, for inviting me, and also Yvonne, who I've been working with for quite a while. We do a lot of work in the community, and everyone else on here. I really appreciate, and I'm thankful to be a part of this group. Thanks a lot. Any questions?
Well, thank you so much, Aurora. And we're asking people to put questions in the Q&A so that those questions can be answered by any of our panelists. So if you have questions, please feel free to put them in the Q&A. We have tremendous partners who are just waiting to answer those questions for you. Want to again appreciate Afton and Aurora. This is so important. We can't give you all of the details today, but please feel free to contact the Greater Flint Health Coalition or Michigan United. And certainly ask questions. If you're not utilizing either resources, ask the person who's completing your taxes to make sure that you have access to this information. So we want to move now to the city of Flint. We're delighted to have Lottie Ferguson, but I saw we have Mike Brown with us also, who's been sharing with us. So Mike, I understand you have some information that you want to share with us today.
Yes, good afternoon. The testing for COVID-19 viruses in the wastewater and the wastewater sludge that's produced, the first company has finished, and currently U of M is taking samples I don't know if it's every day or 3 times a week, but they are coming in and grabbing samples and taking them back to their labs to do their testing. So I just wanted to make sure that people knew that we are assisting them in trying to get as much information from the wastewater as we can of what's going on in our city.
And thank you so much, Mike. Several months ago, Dr. Reynolds mentioned to us, because in other communities, they had identified the coronavirus in the wastewater. And so that was another way to kind of see where outbreaks might happen. So we appreciate knowing that our water department is giving attention to that. So thank you so much. Lottie is going to give us some more updates from the city of Flint as well. Good afternoon, Lottie.
Good afternoon. I did want to talk to you today about the meeting that City Council members did call tonight at 5, I believe it's at 5 p.m.
5:30.
5:30. Thank you.
5:30.
I'm pulling this up right now. It's 5:30 tonight. It is an electronic public meeting, and it's to discuss the secondary water supply. I unfortunately am not in favor of the wording that they put out on this electronic public meeting notice, because we want to make sure that it's clear to city residents that we are not switching the water source. It is a water supply switch. The water will continue to come from Lake Huron. We're putting in the secondary water pipeline. And so there is some work to be done as far as our infrastructure is concerned. And we know this, there are several projects that needed to happen, per some of the regulations that we received from the EPA. So again, if you are interested in hearing more about the secondary water supply, there is a public meeting being held tonight at 5:30. You can get more information on how to join that meeting on the city's website, cityofflint.com.
So Lottie, just to clarify for our audience today too, it is required by law that the city has a secondary water source. And maybe Mike can answer this for us. Why is that so important? And I think I know the answer to that, but I'd like the expert to tell us, why is it important that we have a secondary water source?
It's important that we have a secondary water source in case anything happens to our primary water source. And as Lottie said, it's not a switch. We take all of our water from Lake Huron. All the water comes from Lake Huron, goes to a water treatment plant. Right now we have Great Lakes for the next 30 years, but we hadn't had a secondary, and that's what a secondary line or a secondary plant, sorry. We didn't have a secondary plant or a secondary line coming into the city, which is mandatory by the EPA and by Eagle. We now have a second line coming in, and it still is Lake Huron water. That's what we receive. Whether it goes to one plant or another, both the plants that it goes to use the exact same treatment process. They use the exact same chemicals. And although the water, it is the exact same, it may not have the exact amount of chlorine in it. One might be 1.35, the other 1.53. But that's something that we take care of at the water plant anyways, when we add more things to the water to keep it safe and to be in our system. So it's not a change by any means. It's not a switch. It's just, we're going to take a little bit of water out of the secondary line. And the reason for that is because that's a large line. It's over 7 miles long, and we don't want the water to become stale. So we have to take a little water out of it over time. And we're just going to do it as a continual thing once it's put into service.
Thank you. Now, Lottie, there's also another opportunity that's going to be coming up. There is a water advisory council. Would you be able to speak to that today?
As some people are aware, we do, as required by EPA and Eagle, have to have a water supply advisory council. Water Systems Advisory Council, and we are scheduling a public meeting for that to be held before the end of the month. We'll have more details on that council. We actually have a meeting immediately following this to work on getting the agenda and put together and make sure that we dot all our I's and cross all our T's in an electronic public meeting that follows the Open Meetings Act. So we'll hear more about that in a bit, but those meetings will be your opportunity to publicly express concern or give gratitude or get your questions answered to the folks who are responsible for the water system here in the city of Flint.
Thank you, Lottie. Just want to make sure that our community knows, even in the midst of all the other things going on, we are working diligently to continue to provide adequate and proper information about the water source, because we're all still greatly concerned about that. Just before we leave this topic, could you give a contact or a phone number for the meeting that's going to happen at 5:30 in case somebody can't get online? Is there another way for them to access the proceedings from this meeting tonight?
So the easiest way is to check out www.youtube.com/c/Flint City Council meetings to view the live stream on YouTube. If you're unable to view it via YouTube, you can call into the meeting using the number 617-944-8177.
All right, one more time,
617-944-8177.
Yeah, so those of you that are interested in learning more about this, please, it's good that you get involved and know for yourself so that you can help give good information to those who may not have access. So again, thank you, Lottie. Thank you, Michael, for joining us today. And I certainly want to appreciate every one of our participants for sharing today good information. And for those of you that are putting questions in the queue, thank you so much. Your involvement helps us to be sure that we're addressing the issues and the needs that our community is interested in. And it's so important that if you're talking to others in the community, please give us that feedback so we can bring to you the quality information that you deserve. We want to continue to encourage our community health workers and social workers to apply for the continuing education unit or the contact hours. And you can do that by going on to our www.flint hfrcc.org. Go onto the website and make sure that you get that information available for you. We also want to let you know that every week we're asking you to join us. You may know someone that's heard about this but has not been able to access it. Give them this information. Like us on Facebook. More people are using Facebook now than before, and using other elements, but we want to encourage you to like us on Facebook at www.facebook.com/HFRCC. You can also subscribe to our YouTube channel at Healthy Flint. And then, without fail, you can email us with questions or for more information at info@hfrcc.org. Before we leave today, I was actually wanting to share earlier, and it kind of slipped my mind. But there's so much going on, and I want us to give attention to our little ones, to pay attention that children are also listening to the news. They're listening in adult conversations, and we may not be aware of how much they're listening. But we've had experiences where children are also encouraging their parents to make a decision about vaccines, positive or negative. They are greatly concerned too with what's happening to their parents and what they're hearing. We are their examples. And so it's important for us to get quality information. So when we're sharing, let's be sure we also talk to the children about what's happening. During the water crisis, we had to take a little step back and just have direct conversation with children about the impact of lead, because they were wondering if they were being poisoned, if they were going to live or die. It's no different now with the coronavirus. It is of great interest to our children. So please continue to join us in the webinar. Ask those questions that are relevant and ask for the information. Always feel free to give us a call at 810-835-2130. And we'll look forward to talking with you right here next week on the 75th edition of the Flint Community Webinar on coronavirus. Thank you so much.